Nearly 500 top scientists from 34 countries are at this three-day-long meeting, an action session intended to spur both new laws and methods of cutting down or ending smoking.
The wide representation of scientists and educators gathered here gives me great hopes that the solution to the smoking problem is not too far away. Your presence at this conference is evidence that responsible people the world over recognize the very real threat of cigarette smoking and want to do something about it. We have come to the end of an era in smoking and health field. The period of uncertainty is over. While science will continue to probe the reasons why, there is no longer any doubt that cigarette smoking is a direct threat to the user's health. We know for certain that lung cancer, which is climbing to almost epidemic proportions throughout the world, is directly associated with cigarette smoking. We know that the rising number of deaths from heart disease among men and women in the prime of life is related to cigarette smoking. We know that the toll from bronchitis and emphysema can be traced to cigarette smoking. And we know that a considerable amount of the other chronic disability is resulting from cigarette smoking. There was a time when we spoke of smoking and health as a controversy. To my mind, the days of this argument are over. Today, armed with the facts that come from careful scientific inquiry, we are on the threshold of a new era, a time of action, a time for public and private agencies, community groups, and individual citizens to work together to bring this hydra-headed monster under control. We now have available to us more accurate information on the specific age groups which are affected. The report indicates that cigarette smoking is associated with as much as 1/3 of all deaths among men between 35 and 60 years of age. Let this conference be the starting point for a concerted worldwide attack on this menace, which is taking far too great a toll of the world's most valuable human resources.
Senator Robert Kennedy, attacking the cigarette companies head-on, declared he'll introduce legislation strengthening warnings on cigarette packages and regulating the time and types of TV programs on which cigarette ads may appear and the number of commercials allowed. Kennedy revealed he'll introduce a bill taxing those cigarettes with higher tar and nicotine rates 400% more than those with lower tar and nicotine content, thus giving safer cigarettes a price advantage. Kennedy then directly attacked the cigarette companies.
If the cigarette industry's economic power were as minuscule as that of the marijuana industry, cigarettes would surely be illegal now and their sale subject to severe penalty as a health hazard. There is, in fact, no safe cigarette, and there is no expectation that one will be developed in the near future. The public must not be allowed to believe otherwise. The 250,000 early deaths are a little less than a seventh of all of the deaths in the United States each year. At present rates, then, 1/7 of Americans now alive, approximately 28 million people, will die prematurely of diseases associated with cigarette smoking. Nearly $300 million a year is spent in the United States alone on television, radio, and newspaper efforts to start young people smoking and continue others in the habit. We cannot seriously expect to make major inroads in people's smoking habits, while $300 million a year is being spent to increase the numbers of those now addicted. The situation is though Smokey the Bear had to compete with a campaign 100 times as powerful, urging people to start forest fires. Action is needed to limit and counteract this massive assault. If we were starting fresh, I would say that the first line of action would be industry's self-regulation of advertising. No advertising of cigarettes before 9 p.m., a step that the National Council of Parents Teachers Association called for in its recent convention. A more realistic definition of programs which young people are likely to watch. A limit of the overall amount of advertising. I emphasize the latter to the networks. because some 15% of their prime time advertising is for cigarettes. If a ban on radio and television advertising of cigarettes is enacted at some point, and this is what I favor such a total ban, they will be better prepared if they have voluntarily scaled down their volume of cigarette advertising and have replaced it with other sponsors. Short of enacting a ban on advertising, which does not seem likely at the moment at least, what might the Congress do now? We can enact the Tar and Nicotine Bill proposed by Senator Magnuson, who has led the fight on smoking and health in Congress, and will address you later this week. This bill would require disclosure of tar and nicotine content, packages, and in advertising. I believe the bill will encourage a constructive reverse tar derby, and I think it should therefore be enacted in this session of Congress. In addition, I plan tomorrow to introduce two bills relating to advertising. The first is a strengthened version of Senator Newberger's bill to require a warning on all advertising. And the warning would be, cigarette smoking is dangerous to health and may cause death from cancer and from other diseases. While the 1965 labeling law was a small step forward, it has not reduced smoking appreciably, and it is time the warning requirement was extended to advertising. The second bill would authorize the Federal Communications Commission to regulate the times and the types of programs on which cigarette advertising may appear, and the overall volume of cigarette advertising as well. These are self-regulatory steps I have called for from the industry, but the FCC should have the power to impose them if the industry does not act. Or rather, let Emerson Foote say the last word, since he put it so well. Here's what he wrote to me recently, and this is the entire letter. He said, "To me, the situation of cigarette advertising on television is like this. Number one, television advertising encourages people to smoke cigarettes. 2, cigarettes kill people in large numbers. 3, it is not morally justifiable to encourage people to kill themselves. And 4, therefore, cigarette advertising on television should be banned." And with all of these points, I agree. And that is why I will introduce a third bill tomorrow to to establish a sliding scale tax on cigarettes. The current rate is $4 per 1,000 cigarettes. Would remain on cigarettes with less than 10 milligrams of tar or 0.8 milligrams of nicotine. Others would be taxed at higher rates, with a maximum rate of $15 per 1,000 imposed on cigarettes with more than 30 milligrams of tar or 1.6 milligrams of nicotine. Roswell Park figures show that 18 brands would fall in this category, as would most of the 100 milligram cigarettes, new since the Roswell Park study was released. The legislation would speed the development of low-tar, low-nicotine cigarettes and enable the public to spot the most dangerous cigarettes by their higher prices. None of these matters that I've raised today are easy questions to answer. If they were, you would not be here. Nor will the effort which you chart this week result in immediate success this year or next. And the 3 bills which I shall introduce tomorrow may not be immediately enacted. For the industry we seek to regulate is powerful and resourceful. Each new effort to regulate will bring new ways to evade, just as the television advertising ban in Britain brought forth an intensified coupon war to promote smoking. Still, we must be equal to the task, for the stakes involved are nothing less than the lives and the health of millions of people around the world. But this is a battle that can be won, and with the commitment that is demonstrated by this conference, with the commitment that all of you show in being here and in your work at home, I know that it is a battle that will be won. Thank you very much.
The frontal assault on smoking continues tomorrow and Wednesday. This is Jules Bergman, ABC, at the World Conference on Smoking and Health in New York.
I'm going to be very big with the cigarette companies at the end of this speech.